We've invited you here to learn about a new analysis of the Colorado Health Access Survey, or the CHAS, that looks at emergency department use in Colorado. You remember the CHAS is a program of the Colorado Trust that we do in partnership with the Colorado Health Institute. They manage the data, and they've done this analysis today. The data today are based on the 2011 survey. What most of us call ERs in the industry are called EDs, provide critical health care to us in Colorado, an important part of the overall system. And we're fortunate to have around 80 emergency departments in Colorado. We know, and our data from the CHAS confirm, that emergency department use is going up, and we have increasing demands on this precious resource. This morning we're going to use these data to explore the issue and hopefully have some discussion about potential policy and system solutions that hopefully will help Coloradans get the care they need when they need it at the most appropriate place for the most affordable cost. We're going to first share an overview of the data with you, and then we've invited a panel of experts to help explore and discuss the issues that the data bring up. Jeff Bontrager will take us through the CHAS findings. Jeff is the Director of Research on Coverage and Access for the Colorado Health Institute. Jeff?
Well, thank you, Ned. I'm really proud of this work that I'll be presenting, and the first thing that I need to do is to thank my colleagues at the Colorado Health Institute. But I'd also like to thank the Colorado Trust for this opportunity and their investment in ongoing data collection and learning how Coloradans use the healthcare system. And as Ned mentioned, this is what they have invested in, the Colorado Health Access Survey. And just a little bit about the CHAS. It's a telephone survey of about 10,000 households. It's a follow-up to a survey that was conducted in 08-09, and it includes about 1,200 interviews of Coloradans who only have a cell phone. It's important to keep in mind that these data are all self-reported data, and there's a lot more on the methods in your issue brief if you want to look at that. But one thing that I'd like to emphasize is that the CHAS is really the only data set that we have here in Colorado that offers a comprehensive glimpse not only into the health insurance of Coloradans, but also how they access health care. And as Ned mentioned, one note is that throughout this presentation, I'll be referring to emergency departments or ED use, but the actual question that was on the CHAS referred to emergency rooms. There's many interesting findings, but there are three in particular that I'd really like to highlight that I found the most interesting or thought-provoking or surprising. And they're what I hope you go away from this presentation with today. The first is that ED use is growing in Colorado, and the rates of ED use are often disproportionate among many vulnerable Coloradans. I'm going to be delving into each one of these points here shortly in the presentation. The second is that the uninsured visited the ED more than some of the other insured groups, and this was a little bit surprising to those of us who looked at this. In particular when compared to some of the other insured groups like Medicaid and the Child Health Plan Plus. And then the third, and this might be the most thought-provoking piece, is that nearly half of emergency department users said that they could have gone to a regular doctor for their last emergency department visit if one had been available. And why do we care about emergency departments? Well, of course, EDs are critical. They play a critical role in our society, and they have to be prepared to see about just about anything that comes through the doors 24 hours a day, 7 days a week. The fact is that ED use is growing according to the CHAS. A lot of people speculate that it will continue to grow as a result of health reform. In Colorado, between the last survey and the 2011 survey, it represented about 150,000 more individuals who said that they used the emergency department at least once in the past year. And this represents about 22% of the state's population, up from about 20% in the 08-09 survey. We suspect that there's a lot of different factors at play here, including the impacts of the poor economy. It's possible that people have lost their their insurance, or that they have found themselves newly eligible for public programs, or that there are increased demands that are placed on the safety net in the community. We also care about ED use because it's a relatively expensive place to receive care, especially for primary care type services. So we want to tease out what is that inappropriate use, and also whether we can prevent people from needing emergency department services in the first place. So let's talk a little bit about who uses the emergency department. What I've shown here is the percent of each group listed who reported at least one visit to the emergency department in the past year. So, for example, just looking at that top line there, of all young children in Colorado, ages 0 to 5, 28.4 visited the ED at least once. So this may come as no surprise to some of you, but what we found is that it's often Coloradans who are the most vulnerable to being disenfranchised in one way or another from the healthcare system who use the ED, so children or seniors or those with a disability. And I think that this slide actually sums it up most for me, that those who are most vulnerable in terms of income tend to use the ED services most. It was really amazing to me to see how the data reflected this kind of stepwise pattern that as income increases, your use of the emergency department decreases. And by the way, this stepwise pattern was found to hold in the 08-09 survey as well. Another benefit of the CHAS, of course, is that we can look at regional differences. And as you might expect, we see that some of the urban areas represented by the darker colors here, with the exception of some of the more affluent suburban areas, have a higher rate of emergency department use than the state average of 22%. So the second point that I wanted to talk about was one factor in particular that we found interesting and a bit counter to conventional wisdom. So we've heard a lot about the uninsured, and the implication is that they rely on the emergency department to receive a lot of care that they may not be able to get otherwise or in other venues. What we found in the CHAS is that their use of the emergency department was actually closer to the privately insured. And this may have to do with the fact that the uninsured are more price sensitive and they may forego care due to out-of-pocket costs that they may face. In contrast, some of the other insured groups were higher. Medicaid was the highest at about 40%. And in addition, those who were underinsured had higher rates of emergency department utilization. And so what we mean by underinsured is these are Coloradans who indicated that they had health insurance, whether it was public or private, but that they spent more than 10% of their household income on out-of-pocket medical expenses. So one of the benefits of the CHAS is that we not only look at rates and percentages like this, but we also can ask people why they use the emergency department. And of course, one of the key policy questions is whether people are seeking care at the emergency department that could have been prevented or that they could have gotten elsewhere, such as in a primary care setting. The way that we asked respondents is whether their last emergency department visit was for a condition that could have been treated by a regular doctor had one been available. And this is a consistent way of asking this question in a lot of other state surveys and national surveys. Of emergency department users in Colorado, about 44% answered yes to this question. So this is where it gets a little bit tricky. Recall that this is all based on the person's perception. It depends on how they think about their emergency department visit and the reason for it and the urgency of that condition. And that is not measured by the CHAS. As an example, one example that I like to use is a parent taking their child to an emergency department for a high fever in the middle of the night. Could that fever have been treated by a pediatrician or in a primary care setting? Yes, probably. But was it a condition that warranted an urgent medical need or urgent medical attention? The answer to that is yes as well. So for those who said yes to this question, we dug a bit deeper and we asked about what are some of the common reasons why people use the emergency department. So for instance, 63% of this group reported an inability to get an appointment as soon as one was needed. And of course, you could select more than one of these choices. 79% reported needing after-hours care, and 45% indicated the convenience of the emergency department. And this one is of particular interest because it's an area that's ripe for looking at reducing inappropriate emergency department use. So in conclusion, in the issue brief, we discussed some of the policy implications in the paper, or some of the policy implications of ED use, and such as, do we have an adequate supply of providers? Are people using the emergency department because of barriers in the community? And I would submit that we not only need to think about primary care, but also access to specialists. The impact of federal and state reform, and in particular, those payment reform initiatives that are looking at reducing emergency department utilization. I should just note that the brief also examines the frequent users of emergency departments. I believe the panel is going to talk more about these sorts of policy implications more in depth, but just to review kind of the three main takeaways that I found most thought-provoking. One is that ED use is on the rise, and it's often the most vulnerable Coloradans who are using the emergency department. The second is that contrary to conventional wisdom, the uninsured actually had ED use rates that were lower than some of the other insured categories, such as Medicaid. And the third is that about half of Coloradans indicated that their last visit was due to a condition that could have been treated by a regular doctor had one been available. But keep in mind that many of these visits could have in fact been conditions that were in urgent need of attention. So thanks again, and with that I'm going to turn it over to Ned.
And I thank CHI's analysis and specifically Jeff's work in his presentation today. I'll just summarize quickly the points I think we talked about. That, we know that 1 in 5 Coloradans rely on emergency departments for at least part of their care. A large percentage of those would identify that they could have gotten that care from a regular physician by self-report. We know that Medicaid and Medicare individuals have higher rates, and that could reflect those populations. Remember, 0 to 5 was one of the high use groups, and they're more likely to be, Medicaid covers children. I think that's one of the driving issues, and older adults as well have more health care needs. There may be other reasons that weren't identified, that it's not always easy to find a provider who will take Medicaid. We've gotten better with enriching reimbursement rates, but it's still an issue. And now, as we look at Medicare, there could be similar issues in parts of the state as well. I think we have challenges to improving health access and lowering costs that were well identified by our group. It's our hope in providing these information that we stimulate these dialogues between healthcare leaders and decision makers to design those system solutions that will bring down cost and improve availability. Again, we'll repeat the CHAS in 2013. Late next year, we might anticipate the result. I urge you to go to the CHAS website, www.cohealthaccesssurvey.org, for these data, for additional issue briefs that we've published in the past, and for those of you who are researchers, access to the data set itself. I appreciate your time, and I hope you have a great day.